This show is part of the Recovered Life Network. Check us out at recoveredlife.tv.
When medical professionals and the general public discuss borderline personality disorder, conversation almost universally centers around its primary psychiatric criteria: intense emotional instability, fear of abandonment, impulsive behaviors, and turbulent interpersonal relationships. Because BPD is classified as a mental health condition, treatment plans focus almost exclusively on psychological modalities like dialectical behavior therapy. But according to an eye-opening clinical review published by Medscape Medical News, focusing solely on emotional symptoms overlooks a critical, life-threatening reality. Individuals living with BPD suffer from significantly higher rates of severe physical health comorbidities, including cardiovascular disease, metabolic syndrome, chronic pain disorders, and autoimmune conditions, leading to a dramatically reduced life expectancy driven by physical illness. Medical researchers point to a complex interplay of neurobiological and systemic mechanisms behind these elevated health risks. Living in a state of persistent, high-grade emotional dysregulation keeps the body's sympathetic nervous system and stress response axis locked in constant overdrive. Over years, this chronic elevation of cortisol and inflammatory cytokines damages vascular walls, impairs glucose metabolism, and disrupts immune system regulation. Compounding these physiological stressors are severe sleep architecture disruptions, high rates of co-occurring sleep apnea, and lifestyle factors that frequently accompany chronic psychological distress. Adding to the biological burden is a severe systemic barrier known as diagnostic overshadowing. Due to pervasive stigma within healthcare settings, physical complaints voiced by patients with a BPD diagnosis are frequently dismissed by medical providers as somatic exaggerations or attention-seeking behavior. As a result, early warning signs of hypertension, diabetes, or autoimmune dysfunction go undetected and untreated until they progress into acute, late-stage medical crises. Ultimately, Medscape's clinical analysis calls for an urgent shift toward integrated, whole-person care. Primary care physicians and psychiatrists must break down the artificial divide between mental and physical health by routinely screening patients with BPD for metabolic, cardiovascular, and inflammatory conditions. By combining evidence-based psychotherapy with proactive, compassionate physical health monitoring, healthcare providers can dismantle diagnostic stigma, prevent premature chronic illness, and ensure that individuals living with BPD receive the comprehensive care required to live long, healthy lives.